Hi, everyone. My name is Jessica Farrell. I'm a clinical pharmacist at Albany Med, Division of Rheumatology, and professor at Albany College of Pharmacy and Health Sciences. Today, I want to talk about a recent article that I think is very helpful to my practice in regards to safety. So as a pharmacist, as part of the team, I am often talking to patients about safety concerns. So one of the biggest barriers to starting medications, particularly biologics, targeted synthetics, is safety. So patients will read on the internet, they'll hear commercials, they'll hear from friends, and they get those pamphlets from the pharmacy that have tiny writing of everything under the sun that could happen to them as side effects. And it can be really scary depending on their level of education. So my role on the team is really to help with quelling some of those concerns, really giving them, evidence-based information on what we see in terms of safety profiles for these medications, and give them, some patients even want to hear the numbers. So the article that I want to talk to you today about is called The Safety Profile Upadacitinib Over 15,000 Patient Years Across Rheumatoid Arthritis, Psoriatic Arthritis, and Atopic Dermatitis. It was published in February 2023 in RMD Open by Burmeister et al. And I think that this is really important data to have because it gives us so many patient years of data to look at exposure of the medication. And it's also across multiple indications. And it's which are somewhat of a diverse population. So that gives us a little bit more ability to extrapolate the safety results to our patient population. So the study's objective was to evaluate the incidence of treatment-emergent adverse effects and adverse events of special interest associated with upadacitinib. The analysis revealed that there were treatment-related events per 100 patient years that ranged from a total of 205.5 years in RA and 278 years per patient years in atopic dermatitis. The serious adverse events were observed more frequently in the RA and the psoriatic population, and I think that makes sense given the patient characteristics and disease activity. So the most important thing was that the treatment-emergent events that were leading to discontinuation were relatively consistent across the whole cohort, so that's good. So when I think about using upadacitinib, I think of the JAK class and thinking of, how am I choosing one JAK over the other? And is there a difference in safety profile? So we all know that the JAK inhibitors all carry the same box warning. And the question really still is this a class effect or is this a individual medication within the class effect? So I think as we get more and more information, we might be able to tease out and answer that question. So some of the key highlights of the findings that they found in this study were, from safety perspective, was related to herpes zoster, which is very important to me because, when we're starting the medication, we often talk about vaccination like ASAP. And some patients, it's a little overwhelming to say I need to get a vaccination before I start a medication. So, maybe if we're thinking about using a JAK inhibitor or upadacitinib specifically early, in the future, we might think about proactively vaccinating patients against herpes zoster. The other safety findings that they looked at were non-melanoma skin cancers. So I'm always counseling patients about the importance of doing skin checks and wearing sunscreen. And then the other safety parameter was creatinine phosphokinase, so CPK elevations, and comparing those three events in the upadacitinib group compared to the active comparator like adalimumab and methotrexate. So when we get to the results, so related to herpes zoster, so the rates of herpes zoster occurred in from a range of 1.6 to 3.6 per 100 patient years. So for those of you who might not be as familiar with how to interpret statistics when they're reported as incidence per 100 patient years, so you can break that down. So if you were to treat 100 patients for 1 year, there would be a a range of 1.6 to 3.6 events of herpes zoster. I mean, I don't know if we have 100 patients. I mean, if you're in a big practice, maybe that we're going to put on in one single year. So you can break that down further to say per 5 years. So 20 patients over the course of 5 years, you'll have a range of 1.6 to 3.6 events. So that helps me explain it to patients a little bit better. And I think that does highlight that, that higher end of the range is that, the importance of vaccination. And the incidence was more, like when they broke down between different disease states, it was a little bit higher in the RA and psoriatic arthritis patients. And then serious infections also, those range from 0 to 3.9 per 100 patient years. Again, in that RA and psoriatic population that were the higher range of those years. And then the other major safety things that we look at and think about with JAKs, as I already mentioned, is the fact that all JAKs have this box warning related to cardiovascular events, and that in patients that have at least one cardiovascular risk factor over the age of 50, there could be this increased risk of cardiovascular events and or VTEs and malignancies. So this is a very important safety measure to look at and continue to look at in our patients with upadacitinib, because we know that the oral surveillance study was done with tofacitinib. So again, trying to help us get a little bit more information to answer that question of, is this a class effect? So what this study found was that the incidence of MACE events, so MACE is major adverse cardiovascular events, was found to be very low, 0 to 0.4 per 100 patient years, and then, which is very, very low. And then the incidence of VTEs was less than 0.1 to 0.4 per 100 patient years. So again, very tiny numbers. We still need to keep an eye on this. We still need to think about whether in these studies was there what we call channeling bias. So depending on when the patients were enrolled in this study, did they have risk factors? Were they patients that maybe were less cardiovascular risk? So that's what channeling bias means. But again, it's still a very large cohort, which can help reduce those concerns and those limitations. And then the rates of malignancy, excluding non-melanoma skin cancers, were comparable to those observed in the active comparator groups, which were generally methotrexate and adalimumab. So again, I think that this is helpful information. There's one last safety measure that I'm going to talk about related to this study, and that was in the atopic dermatitis group. And I think this is important because rarely, and a handful of times in my patient population, I've had patients complain of acne. So this study did show that in the atopic dermatitis group, which I will point out, they use a dose of upadacitinib 30 milligrams daily, whereas in our RA, psoriatic, and ankylosing spondylitis patients, we use a 15 milligram per day dose. But in this atopic dermatitis patient population, there was higher incidence of acne compared to the other groups. So that seems to be potentially a dose-related effect, and that's something that we want to keep an eye on also. I think those are kind of the main points that I wanted to talk about. Again, I think we have upadacitinib is a great option, especially for patients who have failed other agents, who don't want to do injectable. It's an oral route, which makes it very convenient for our patients. We see good results with it. And again, we just need to stay on top of the safety data. So this study really helps give us that confidence that what we're seeing is consistent across duration of treatment and years. So having such a big cohort was really helpful to give me some, solid numbers to provide to some of my patients who like to hear those numbers and have the data and evidence behind the safety to really make an informed decision on whether they want to start treatment. So I hope you found this journal club effective and helpful, and that you can use this in your practice. For more information and more journal club video modules, head over to the WRAP website. We also have the WRAP cast, and we also have our annual meeting. So I hope that we will see you on one of those platforms. Thank you.